If you have got anyone in your family who is above the age of 55 and they complain of multiple joint pain in their body, then it might be because of osteoarthritis. In patients above 55 years old, there are 80% of them who would be suffering from osteoarthritis. Osteoarthritis is a degenerative condition of the joints. In this, what happens is the joint undergoes degenerative changes, as a result of which there is pain in these patients and their mobility is lost. It can be due to genetic causes, which is due to an autosomal dominant gene, in which you would see that it would be present in the previous generation, and in the subsequent generation also it would be present. But the most common cause of this is because of the various risk factors which are associated with it. The risk factors, the primary one which we spoke of, is that the joint disease due to age-related degeneration. Second, can be due to obesity. If you're obese, what happens is your bones have to bear a lot of mechanical load, as a result of which it can undergo a degenerative change in them. This is due to obesity. The other thing that happens is because of smoking. Smoking is a major risk factor. Vitamin C, vitamin D deficiency can also be seen being associated with this condition called osteoarthritis. So what happens in osteoarthritis is that the normal cartilage undergoes degeneration with age. So I want to tell you that if this is a bone and there is a cartilage layer over it, between the joint, these two cartilage layers forms the joint. So for example, this is a knee joint. Okay, this is the cartilage layer above here and below here in the femur and in tibia. These two form the joint. What happens is the normal cartilage degeneration and the repair mechanism, if there is any kind of discrepancy in this two, then what happens is there would be loss of the normal cartilage in those individuals. This loss is more common at the regions where you have more weight bearing or where there is more mechanical strain. As a result of which, what happens is those areas there, you would see that there would be focal loss of cartilages. For example, if this is the knee, if this is the inner side or the medial side of the knee, and this is the outer side or the lateral side of the knee, you would see that there would be more focal loss of articular cartilage at this region. As a result of which, what happens is they rub against one another. This rubbing produces pain in those patients. This is called subchondral rubbing. This rubbing leads to pain, and there is some kind of loss which is called sclerosis that occurs in those bones. There might be outgrowth of small bone particles. For example, if there is rubbing, so bone has a tendency to heal, so it will form a small outgrowth of bone particle at the end, which is known as osteophyte. These osteophytes, subsequently with time, what happens is it gets separated and forms a small bony fragment which is called a loose body. This loose body, they rotate around that joint, and every time you move those joints, you hear those crackling sounds, which is called crepitus. It is a very common thing, and this rubbing leads to eburnation. Eburnation, the process in which these two surfaces, they come in contact and they produce pain. This is called eburnation, and this eburnation gives a tremendous amount of pain to those patients. It is most common in knee and hip joint. The other joint which can be involved is that distal interphalangeal joint, proximal interphalangeal joint. It is less common in metacarpophalangeal joint. Similarly, in cases of foot also, it is less common in hand and wrist, but it can be present. It can be present anywhere you have a trauma. So if any joint has got any kind of trauma, then there you can have a secondary osteoarthritis that can occur in those patients. One of the major site of this osteoarthritis is the facetal joint of the intervertebral of the vertebra. So the superior vertebra and the inferior vertebra, they both are connected with one another through a joint that is called facetal joint. So facetal joint hypertrophy and osteoarthritis can occur in older ages and can also be seen in patients with high impact sports activity. For example, those who are doing this basketballs or high impact sports activity, those who are doing, there you can see these osteoarthritis in those patients. What happens is there would be inflammation of the joint because of this rubbing, and there would be excessive pain. Osteophytes would be there, and because of this pain, there would be localized accumulation of pain producing substances, or these would lead to subsequent stretching of those ligaments and muscles, and again would lead to pain and limitation in activity in these patients. So what can we do for these patients? The first and foremost thing that we should do for these patients is to educate them regarding their condition. They should know that what is osteoarthritis and what is happening to them. Second is that we should remove those modifiable risk factors. For example, if you're smoking, you should give up smoking. If you are going for any high impact sports activity, then you should reduce that. Third, that you are very obese, you have gained a lot of weight, and if you reduce your weight, then there is a very high chance that you would get relief of those pain. There are so many studies regarding this, and it is said that just by reducing 5% of your body weight, you can bring this down, and that pain can reduce substantially, and you can feel very good with it. Next thing that we should do is we should induce exercises in those patients. We should ask those patients not to stay idle in their house, rather to do certain exercises for that disease. So what exercises can be done is, see, I personally believe that the best exercise should be swimming, because in swimming you do not exert too much pressure, there is no too much strain over the joints, so you can swim, your muscles would get adequate exercise that is needed, it would get good strengthening, and it would also help in reducing the strain that you are facing. The muscle hypertrophy would occur, and again it would help in dissipating the strain on the joint to those muscles, and thus help in the joint. So what happens is, if you're taking capsaicin, then it would lead to increase in the production of hyaluronic acid, which usually helps in production of this joint fluid, and thus it would reduce that eburnation of the joint, and it would lubricate those joints and thus reduce the pain in those patients. Other medication which are there, like diacerin and glucosamine, which is very commonly, I see nowadays that people are taking it over the counter. There are certain companies which are promoting that this is a knee joint pain reduction medication, but in reality it's not a painkiller. Like glucosamine and diacerin medication, it helps in reducing pain, but studies suggest that it does not affect that much. It cannot reduce the pain so much, but people tend to take it. Usually it is not advised to take. It does not have till date, in most of the studies, it does not show any significant pain reduction or disease modification because of its intake. The third group of medication that we take here is a painkiller. So I must tell you here that painkillers are very bad for your health. Until unless you have severe pain, you should not take painkiller. And before taking any kind of painkillers, you should consult to your nearest physician, who would decide the duration and the dosage of the painkiller and the type of painkiller that you should take. For example, someone is having a cardiac disease and you are giving a diclofenac tablet to those patients. You are in turn creating a cardiological risk to that patient. You are giving aceclofenac to a patient, and he or she is a patient of renal diseases. Then you are causing more renal damage to those patients. Hence, we should not take it like that. We should consult our nearest physician, that physician or an orthopedic surgeon, who would decide the duration and the dose and the type of medication that you should be taking for that while. The other medications that are available in the market is, one is this hyaluronic acid injection or the PRP therapy. So what is hyaluronic acid injection is that this hyaluronic acid forms the joint fluid. So what happens is, these are pre-filled packs of injection which are available. What we do is we insert that fluid in that joint, as a result of which there is absorption of the fluid from the surrounding tissue. This would lead to better lubrication of the joint, as a result of which there would be reduction in the pain that the patient is suffering from. There are various studies which suggest that this use can help, but there are also other studies which says that its use is somewhat dicey, and it's not that effective in some cases. Mostly in the initial stage, it has better impact. I see in my practice that in the initial stage, it has got better impact, while in the stage 3, if we are trying, then we cannot do anything for the patient. The third, which is there, that is PRP, or platelet rich plasma. What they would do is they would take a part of your blood, they would enrich that, and they would reinsert it in your joint. What it does is it helps in promoting that cartilage repair. So there is less cartilage loss, it helps in cartilage repair, and thus there is less eburnation that would happen, and it would slow this degenerative process in your body. Hence, it is also very effective. The last and the last resort for any of the surgeon in any conservative line of therapy is this corticosteroid injection. So what they do is they take corticosteroid and they inject in that region. What corticosteroid does is it would reduce those inflammation at that site, and thus reduce the pain for those patients. It should not be given for more than 4 times a year. And once you have started giving that, what happens is those joints, they go for necrosis, and you cannot reverse those necrosis. So if you're planning for any surgery in nearest days, any joint replacement surgery in the near future, within 1 year or just after 1 year, then you should think of going for a corticosteroid therapy, or else I personally don't feel that you should go for a corticosteroid therapy. Then the last resort for everything is surgery. Surgery, there are two primary surgeries which are taking place. One is this high fibular osteotomy or high tibial osteotomy. What they do is they cut a part of fibula, as a result of which the weight bearing becomes little bit even, and thus the pain reduction would happen. The second is high tibial osteotomy. What happens is because of this excessive pain, there is bending of the knee joint. So what they would do is they would align those joint, as a result of which the pain reduces. The third, in cases of knee joint, it is replacement. So whether it is a knee joint or any other joint, if you are doing any kind of replacement, then what happens is you are removing those surfaces which are getting rubbed against one another. So you remove it, you put a metallic stent over it, as a result of which there is less friction in those regions, and there is less pain to the patient. This can be done by total knee arthroplasty or unicondylar knee arthroplasty. It can be done using a total hip replacements. Now it can be done in spinal stabilization, can be done for those patients where there is movement between the facetal joints, and even small joint arthroplasties are also available that you can go for. I believe that this gave you a brief idea regarding this condition, and the primary and the foremost thing that the patient should do is get educated regarding the condition that they are suffering from, and that is how they can empower themselves and can have an informed decision regarding their treatment. I believe this video was helpful to you. If you like such video, please like this and share it with all of your friends, those who need to understand this disease better. And if you want to watch more contents like this, please kindly subscribe to this channel and press the bell icon for subsequent videos of this sort. Thank you so much.